Okay, good morning. Welcome to the President's Chat. My guest today is Liyanage.
Yeah.
I've
Hello.
got this really difficult surname, so I guess you know what that feels like when people always struggle to pronounce your surname.
It's okay.
It's wonderful to have you here. It's been a long-term wish of mine, actually. You are on our Queensland Medical Women's Committee as our student representative coordinator.
Mhm.
And very importantly, you actually organize our mentor mixers. We have been wanting to organize these mentor mixers for a long time, haven't been able to really find a way how to do that. And then you came along and you are amazing at organizing these. So we're very grateful for that. But as like with many busy people, there's a lot going on in the background. And as with a lot of beautiful medical students who are always very humble about all the other stuff that they do, um, you just mentioned sideways one day that there was this foundation you were working on. And I've always wanted to hear more about it. And I think it's really important for all our members and the bigger public to hear more about the wonderful work you're doing. So that will be the main topic for us to speak about today, and I'm really grateful you are here to show us more. You've actually made a PowerPoint because I think this is a topic that can really benefit from some images as well. So
Yes.
you can actually show us what it is. So, Udani, you are the co-founder and Queensland Director of the Noble Dawn Foundation.
Mhm.
Can you tell us a little bit more about it?
Sure. So thank you so much, Ira, for having me on board. I've always seen the president's chat, and it's always lovely to be invited. And of course, the mental mixes will always be my first passion, but of course, the foundation is another passion of mine. So yes, I am the co-founder, and I've actually been the director for Australia now. So I take on board Queensland and Melbourne at the moment. So yeah, my partner Avinash and I actually co-founded this foundation in August of last year. We are currently registered in Sri Lanka and we've hoped to become a reliable platform for millions of people across the world to support Sri Lanka. And we really hope to create some long-lasting impacts and changes across our country. So we both were quite passionate about this project. We've both been really lucky to live quite privileged lives. However, it's not hidden from us that many people don't have the same lifestyle we have, and there are a lot of hardships a lot of people faced across Sri Lanka, especially with the 2019 economic crisis that's still ongoing. A lot of basic necessities have become privileges. And whilst we both moved away to Australia, we always know that it will always be our responsibility, in a sense, to give back to our country. And the only way Sri Lanka, I think, as a country can move forward is if communities come together and really help out our country. So, yeah, we initially started with about 5 members in August last year, and we've grown quite rapidly to a team of 24 members, and we're operating in 7 different countries now.
Wow. That's
So,
really quickly. This is from August last year.
definitely, yeah.
Less than a year.
Yes,
Yeah.
actually, we are coming on to our 1 year anniversary.
Yeah, exactly. Yes, yeah. It's
Yeah.
July now. Yeah.
So we've actually done 4 projects since our start, and we have 7 more lined up for the year, 2 of which are ongoing. But we are established across Sri Lanka, Australia, New Zealand, the UK, the US, and Canada. And in terms of kind of our structure, so Avinash is the founder and chairman. I'm the co-founder and Australian director. We have 2 other directors who function in New Zealand and Sri Lanka. We have a secretary, an assistant secretary, a treasurer and auditor as required, and a editor who manages our social and media and PR team. So all of us have kind of been running similar kind of events, and Avinash definitely has been running non-for-profits for about 8 years. So he's very well versed in how to manage these kind of foundations. Probably why we've expanded at such a quite fast rate. Yeah, but we do have, as I mentioned, several projects lined up for the rest of the year, which I'll talk through, mostly why I brought along the PowerPoint just for some visuals rather than just
Mm.
speaking. So for kind of every single project we have lined up, we do delegate a separate team. So we have a project coordinator for every single project who is supervised by an executive director. The project team is also built up with an assistant secretary if required and whoever else is on board to help out with the project for that project. And we do have several focus areas as well. So I might open up the PowerPoint now to run
Yeah.
you through that. Let me just share screen. Did that come up?
Yeah. Yeah. I can see it.
Wonderful. So, our most prominent focus areas, this is all on our website, but I just thought I'll put it into a PowerPoint format just to make it more visual. So,
Hmm.
these are our key six focus areas. So, improving education, economic empowerment, honoring war veterans as well, healthcare and disease prevention, which obviously I'm very interested in, elderly
Mm.
and differently abled care, and nursing orphans. So, as I mentioned, we really also hope to inspire the younger generation to kind of bring communities together and really help out Sri Lanka. This is a bit of an overview of what I'm be running through today. So, in terms of training and development, we've obviously wanted to give people who join our foundation something back. We always want to add value. And as I'm passionate about the mental mixes, we've kind of made our foundation a training platform. So,
Mm.
we have people all the way from CEOs to students to high school students. And we always ask them, what do you want to gain out of the foundation? And whether that's team management, project management, or even something like public speaking, we really hope they gain those skill sets and we try to give these projects in a way that will really benefit them. And our members come from various backgrounds, so healthcare from my end, sales, marketing, procurement, business, and everybody always brings something special into the foundation, and that's something we really hope to maximize. We do have quite a high standard. So to help, I guess, everybody who joins our foundation, we've got templates, role profiles, and operating procedures that really outline exactly what's expected, and it ensures everything's done correctly and efficiently. As we are a new organization, we understand that credibility must be there.
Hmm.
So with every project we've also had a very stringent kind of pathway to accept a new project. So our executive committee and our mission ambassadors do come together and they go through the feasibility, the impact, and the resources required for a project, along with the funding requirements. And that will kind of determine if we can take this project on board or not. At the moment, we only just started, but we are planning to release a prospectus for future projects, and this will just keep our donors and anybody interested updated about what we're doing.
Mm.
So even throughout all of our projects, though, we have kept our donors updated. So the one we recently completed in June, our donors had about 7 updates throughout the course of the entire project, from the construction, during, after construction, and as well as the opening ceremony for the water
Mm.
purification plant.
Okay.
Uh,
That's good.
yeah, so our project proposals, so they're all on our website. If you go through our projects tab, you can find a proposal link with nearly every single project. And that will kind of go through the purpose, the scope. We have risk mitigation tables, project management, fund allocation, and any necessary documentation for the project. And then once a project is completed, we update our website accordingly and we release a project report, which pretty much goes through what was the expected budget, what actually happened with the budget and excess fund allocation, along with some photos and updates as well for our donors. Yeah.
I can
Um,
see where your organizational talents are used as well.
I will say it's not just me. Avinash does quite a lot. He's actually the one who's drafted our operating procedures as well. So
Mm.
in terms of financial transparency, we have a very clear 10-page operating document, and that kind of runs through exactly what's expected every step of the way to maintain that financial transparency. So we know a lot of kind-hearted people do want to donate to charities, but they're not really sure what happens to their money and where it
Mm.
goes. So
Yeah.
that's something we really wanted to change. So we have a two-factor authentication, two-factor receipt tracking method. So all of our receipts are tracked for every dollar that we receive, and they're linked to a unique receipt number, which is then issued to the foundation. And then these numbers are put onto a formal receipt, which is signed by our chartered accountant and issued back to our donors. So as you can see,
Okay.
there's operating procedure on the corner of the screen in the gray and white table. It
Hmm.
kind of lists every single role that the originator, the treasurer, the secretary, and the chairman have to fulfill. So it's quite an extensive pathway, but it just ensures that we don't make any mistakes with any dollar that we
Mm.
receive. So it's not just me, I will say. Um, I don't think we could actually have functioned or come this far without Avinash being, uh, I guess, the chairman and founder that he is.
Mhm.
Yeah. And with our continuity and long-term planning, so we don't just want to give people something into their community. We also want it to benefit them in the long run and not just be, I guess, a short-term solution. So
Mhm.
similar to our most recent project, so a bulk of the time we actually spent on the project was planning the long-term impact we'll have. So we provided replacement filters for the plant. We have an ongoing ground team through the Navy that actually will provide annual reports for our donors to update them on the operational status of the plant. We have a community team that was formed within the village, and they will maintain the plant and give us a monthly report. So we're always in contact with them as well.
Mm.
And we've also trained and developed subject matter experts and possibly considering the additional solar panels to make sure that the plant is self-sufficient as well.
Okay.
Yeah.
And do you have
And
any photos of the plant?
yes, I will run through all of them.
Okay.
I'm so
Yes.
sorry, this part is a
No.
little bit dry. Like, yeah. I guess, and in terms of the future, we are looking at business continuity and cybersecurity planning, just to plan for the event something ever happens. We're always well prepared. So
Mm.
going on to the interesting part. So this was actually our charter project. This is where we started.
Oh,
Um,
yes.
yeah, in October in 2023, we supported about 18 children from low socioeconomic backgrounds and children of war veterans, and we gave them a year's worth of school supplies. And that was where we started. So
And this
we're
was all from donations right from the start.
right from the start. We are very lucky to have a lot of people partner with us and a lot of companies willing to partner with us. We've
Hmm.
realized, I guess everybody's looking for a platform to give back, you know?
Okay. Yeah.
And that
So is it all donated by Sri Lankans or people who have links to Sri Lanka, or do you
not
also spread
not
out?
necessarily. It's quite spread out. So our donations were actually kind of spread across the 7 regions I mentioned earlier. So all the way from Australia to the UK, US, Canada. We've had donations from everywhere, and
Mm.
it's actually just been really wonderful to see how much people are willing to help out.
Yeah.
Yeah, so
Yeah.
this was our first ever project, and our second project was actually quite a big undertaking. And I guess the only reason that we were able to actually complete this project, it was about a 1.29 million rupee project, or about 6,000 Australian dollars. And we set up a reverse osmosis water purification plant. So about 20% of people in the northern province in Sri Lanka suffer from chronic kidney disease and liver failure due to consumption of impure brackish water. And it's been a leading cause of death. So this particular village that we built this plant for, they had been suffering without clean water for about 15 years. And as I mentioned, we have all those long-term continuity plans as well, even after we set up the clinic, after we set up this plant. And you can see in the photos, these were all the photos that we sent through our donors, and it's
Hmm.
found within our website and our reports as well. But that's the construction of the plant, and as well as the opening ceremony there in the corner.
Ah,
Um,
yes.
yeah, so we did partner with quite a lot of people as well, including the presidential task force that does has put up about 1,200 plants, as well as Sri Lankan Navy, Tokyo Cement, and Rushi Water. And we pretty much chose this project because of the long-term impact it will have. And
Mm.
it was really wonderful to see it pan out. So we just finished in June of this year.
Mm. And was it an existing project happening in Sri Lanka anyway, and you did one part of it, or was this the start of all the other projects as well?
So the other water purification plants have been put up by a separate organization.
Hmm.
But the presidential task force had not yet addressed this area. So we decided
Okay.
to set up a
Yeah.
plant here. Yeah.
Yeah.
So
Yeah.
we visited the village in December 2023 and we talked and we confirmed the site and all of that. And we just finished in June.
Amazing.
Yeah. So that's two of our completed projects. I'll run
Hmm.
you through the other ones later, but for now, we do have our some of our ongoing projects. So this is the one that I am actually leading with another project coordinator. So the project coordinator is actually a medical student from Malaysia. We grew up together in school. Um,
Ah,
yeah, so we're working together once again in a different capacity. But we're looking to provide a healthcare community clinic for about 600 patients. We understand that the limited health education and healthcare resources can be a burden. A lot of people aren't able to travel to hospitals, and there's a lot of preventable disease that could be addressed. So we've got gathered about 20 doctors from different specialties, including cardiology, orthopedics, pediatricians, dermatologists, and ophthalmologists, and several GPs and general physicians. And we've partnered with Vision Care, which is an orthoptics brand, who will be providing a discount on all of their glasses and eyewear and 100 eye checks for the day.
oh,
So
wow.
this clinic will be running in November 2024, and I'm very excited about it. And
Yeah.
yeah, so our project proposal will be up and running shortly, and we are looking at just updating the website at the moment.
Mm,
Yeah, so that's another one.
yeah.
Um, This is another one I'm also very interested in next year. So the purpose of this one was that Sri Lanka's got quite a critical issue around breast cancer. So it's about 25% of all cases, cancer cases amongst women, and it has a very high mortality rate, about 42%. So that's mostly because breast cancer is detected in very advanced stages, and the inadequate diagnostic facilities make it really hard for them to improve these low survival rates.
Hmm.
So because the current healthcare system is overburdened and it doesn't have the technology and the facilities to actually improve detection methods, we have partnered with Infinity Pathology in Australia, who have very generously offered pro bono to test and provide the results of samples we'll send from Sri Lanka. So
Mm,
we've gotten in touch with two hospitals, pardon me, Peradeniya Hospital and Kothalaula Defence University Hospital. So we're currently working with them, and they will be the first two hospitals we'll do this project with. But we are currently talking with their procurement officers and discussing options on how to cold store the samples, how to air freight them, and then give them to our service provider, Infinity Pathology, and then issue back the reports. But once we've confirmed, I guess, and tested it on the ground with Peradeniya Hospital and KDU, we'll look at doing it in other hospitals as well.
yeah.
Yeah. And so this was another one of
I'm
the ones.
very impressed.
Thank you, thank you. I definitely think the PowerPoint makes the presentation a little bit less dry.
Well, it
Yeah,
makes it very tangible, actually showing
yeah.
us what you're actually doing and how much you've done in not even a year.
Thank you, Ara. Honestly, I don't think we would have gotten this far without, I guess, the amazing support from all of our team members. And even me and Avinash, like our parents have been such an amazing help. And
Mm,
they've really, because they're back in Sri Lanka as well. So his parents have been a wonderful help in getting everything running up and going on the ground as well. So you'll see
mm.
them in most of these photos. Um,
It's
but
real teamwork.
very much a family effort and real teamwork, really.
Yeah, yeah.
So we just did this medical equipment donation in June. And we donated about 6,000 Australian dollars worth of medical equipment to Panadura Base Hospital. And this was all come through Infinity Pathology and Complete Gastroenterology. And this project is open and ongoing. So whilst we have done a donation last month, we are still ongoing, and we will be partnering with more clinics to bring hospital equipment back into the country for more hospitals.
Hmm.
And in terms of the another project that we've actually completed, so we had a hospital bed and a wheelchair project. So this is also ongoing and open, but we did make a donation just in June as well. So we donated a hospital bed to the obstetrics and gynecology ward in Negombo General Hospital. We are looking at future donations as well. So we currently have another wheelchair and a hospital bed to donate. We've had a lot of wonderful individuals also donate any used medical equipment from their past loved ones and donate it in their name as well.
Mm, beautiful. Yeah.
And this is a repeat of our charter project. So as I said, we are coming along to our 1 year anniversary, and we've decided to bring this back again in December this year. So we're looking at helping a school in Polonnaru rural communities, and it's about 250 students. We will be providing sporting equipment, musical equipment, school maintenance, and technology equipment as well. So I guess it's a big step up from the 18 children that we helped last year, but as I said, we're expanding at quite a fast rate.
Yes. Yes,
Yeah,
you are.
yeah. So that's the next one. And this is another one we'll be doing this year, September. So we're quite lined back to back, November, September, and December. But we will be taking 25 children and their guardians from areas rural areas in Sri Lanka, and we'll be bringing them to Colombo. So the main reason for this project, I guess, was to inspire and motivate a lot of young students.
Hmm.
Not a lot of students have had the ability to come into Colombo City and visit any of the landmarks or see what our country really has to offer. And this hopes to address the gap and also provide some educational facilities for all these students as well.
Mm,
Yeah.
yeah. Very
And
diverse project.
yes, so as I said, like our charity and our foundation is made up from a lot of people from very different backgrounds. So
Mm,
we really wanted people to bring in their ideas, what they're interested and passionate about as well.
yeah. Yeah.
Yeah.
Makes sense.
And yeah, Laptops for Learning project. We've also had a very generous donation of about 5 laptops, and we're currently looking for 5 high-achieving students to donate these to, because we understand whilst a lot of people do get offers into universities, they're not able to afford laptops to continue their higher education. And along with that, we have 10 computer labs, 10 desktops, sorry, and we are looking at setting up a computer lab for a school
Mm.
in Sri Lanka as well. Yeah. So those would be 2 future projects. And that brings me to the end of my PowerPoint. So yeah, we are established and we do have a website, a LinkedIn, Facebook, and Instagram. So definitely give us a follow. We're always welcoming new members as well. So if you are interested in this particular project or you'd love to get involved with social media or PR, we're always welcoming and recruiting new members as well.
Hmm. And
Yeah.
are donations tax deductible?
They go through Sri Lanka actually. So we're not currently registered in Australia.
Hmm.
They go through Sri Lanka, so would follow the tax regulations in there.
Okay.
Yeah.
Yeah. Yeah. And congratulations on the beautiful logo. We were just talking about it before we started the recording, but Udani actually made the logo herself. Do you
Thank you
want
so much.
to explain us what the idea behind it was?
Yeah, so I guess dawn always brings new things, and it's something, this has been start of a lot of new things and new beginnings. So we kind of have a sun there, and I kind of thought this color scheme would match with sunrise. And
Hmm.
we have the hands there in the middle as well. Yeah.
Yeah, beautiful, multi-talented. Yeah. And so you said that everyone in the foundation or everyone you bring aboard, you ask them what they would like to take away from it or what they would like to learn there.
Yes.
What is
Yes.
that for you?
For me, well, I think since I've joined QMWS, I think I've a lot of new opportunities and things have come my way. And I honestly think that's because I put my hand up more than anything else.
Hmm.
Um, and that's something I've really been inspired to do. And for me, the foundation, I guess I'm finding myself providing that same opportunity for a lot of other people. So my friend Akit, who's the project coordinator for the health clinic, I knew how interested he was, and I honestly asked him, like, would you be interested? Because whilst I understand there's a gap, you might not know how to make a project proposal, and that is more than okay. That is why we have templates. That is why we have supervisors, and we're always there. If you ever raise your hand up, we're more than happy to help you and show you what needs to be done. And I guess the foundation for me is also just me providing that same opportunity for other people.
Hmm.
Because I know sometimes it's not because we don't want to do it, it's because we don't know how.
Yeah, exactly. Yeah. Well, and
Yeah.
that's very much, of course, how our whole medical training is actually done. See one, do one, teach one. And and
Very
I truly hope that that is what our younger members get from Queens of Medical Women's Society as well. That's very much what
definitely.
we are hoping to achieve. So yeah, I can understand completely. Yeah.
Mhm. Yeah.
No, I think we have another more or less 5 minutes. And I was really wondering if you can tell us a little bit, because I know you are amazingly busy and this is not all that you do. Can you tell us a little bit more as well?
Yeah, so I am a final year medical student. I'm currently on my ED rotations as well. Aside from that, with Bond University, I'm currently the vice president for the Obstetrics and Gynecology Society. We do quite a lot of educational events, and we post a lot of educational things on our website and social media as well. But we also do have a lot of mentorship events and kind of try to get students the exposure into obstetrics and gynecology that they'll need because sometimes I feel med school you quite rush into some things and you don't really have the proper exposure or mentorship, I guess, to really take you along a career path. So we really hope to provide that for students.
Mm.
Similarly,
So
I'm also
any gynecologists in the Bond area should contact you?
yes, yes, please. We're always looking for speakers to come to our careers nights to tell students a little bit more about what their day-to-day looks like, um, what their career looks like, how they got there. I guess any tips or tricks they had for future students as well. Yeah. So
Okay.
similarly, we're with Obstetrics and Gynecology Society. I'm also in the Opthal Society as the sponsorship director. So the Opthal Society, we are partnered with the Fred Hollows Foundation. So we've done a bake sale recently, and we've also had a career speaker night where we also donated all of our profits from both of those events to Fred Hollows. And yeah, we're looking at hopefully getting some organization and some charity projects done to help out some eye clinics in the Solomon Islands as well. Yeah.
Wow. Is that because you had your internship there or your
Yes.
placement?
Yes. So I did a 7 week placement in the Solomon Islands and um, I was at Helena Goldie Hospital in Munda, and I had the wonderful opportunity of speaking to some of the consultants there, and they were just talking about how despite so many patients, I guess, preventing with such preventable disease, they're just not able to make the trip all the way into the main capital, Honiara.
Hmm. Hmm.
And it's quite because the geographical, I guess the geographical way that Solomon Islands is set out, it's quite hard to make it into the capital if you don't have a boat and all of those other resources. So we were just talking about how we could help out Helena Goldie Hospital in Munda and donate some of any eye equipment there.
Wow. So you
Yeah.
really are the example of asking a busy person to make things done. And then, so you come to a new place, you watch it, and then you actually come up with practical solutions. I think that is,
I'd like to think so.
yeah, yeah.
Thank you.
Well, I think that is commendable. So thank you for that. Thank you for all that you're doing. And I think that is it for today. I'm sure we could speak for hours and hours more, but I
I'm
want to
sure.
thank you for today. And you're off to your emergency shift this
Yes,
afternoon as well.
yes, I am. My sleep schedule is all over the place, but yes, enjoying it
Yes.
so far.
So thank you so much for being my guest today. Thank you so much for everything you do, for the beautiful explanation.